Hello everyone, it's another day and I hope you are doing well and I'm good too. So welcome to our today's discussion, which is a continuation of yesterday's topic on peptic ulcer disease. So today I want us to look in the pathophysiology, clinical presentations, examination findings, and also some investigations that you'll be required to do once suspected to be having peptic ulcer disease. So let us start with the pathophysiology. When we talk of the pathophysiology, we are simply looking at how peptic ulcers occurs, what makes them to occur. So in this area, you'll find that there are two main factors that are involved in the pathophysiology. The first one is what we call mucosa protective factors, and this includes things like mucus, mucosal blood flow, bicarbonate, epithelial renewal, among others. And we also have what we call factors that tend to cause injury to the mucosa, and this includes things like acids and pepsins, drugs like the NSAIDs, as we saw, bacterial infections, like in the case of H. pylori, alcohol, smoking, among others. So you'll find that for peptic ulcers to occur, there is imbalance between these two factors. So in short, we can say that peptic ulcers occurs when there is imbalance between mucosa protective factors and factors that tend to cause injury to the mucosa. Now let us look at the clinical presentations. The most common symptom is epigastric pain. So you realize that there is some pain in your epigastric region, which looks like, oh, it appears like something is, you will feel like something is burning in your epigastric region. So that's what we call epigastric pain. So it's the most common symptom. And remember, it can occur 1 to 3 hours after a meal, but it can also occur at night, as we saw in the case of duodenum ulcers. Another presentation is that you'll find that you have nausea. This is the feeling that you feel like you want to vomit. Every now and then you feel like you want to vomit. That's what we call nausea. Another presentation is vomiting. You can present with vomiting, which is related to gastric outlet obstruction. Another clinical presentation is something called dyspepsia or indigestion. You will experience, in this case, you will experience things like bloating, belching, distension, etc. And we also have other presentations like chest discomfort. You will feel like you're having some discomfort in your chest. You can also present with what we call anorexia or lack of appetite. Most of the time you'll have no appetite for food. Another presentation is weight loss. You'll realize that your weight is going down. And you also have other presentation like hematemesis, whereby it's vomiting of blood. Or you can also present with Malena stool, whereby when you go for a long call, you realize that your stool is somehow blackish. So those are the clinical presentations. Now let us look on the examination findings. Once you visit the hospital, the doctor will do some examinations. And in the examination, you will find that you have epigastric tenderness. So that is in the palpation. While palpating, you will have some tenderness in the epigastric region. Another examination finding is what we call succussion splash, which is resulting from either partial or complete gastric outlet obstruction. You can also have another examination finding we normally call pallor. This might be as a result of blood loss. Remember, we saw that in the presentation, you can have what we call hematemesis, that's vomiting of blood, and you can also have Malena stool. And those two shows that there is some bleeding inside you. So they can lead to loss of blood, and that will present with pallor on examination. Now let us look at the investigation. Which are the investigations that you'll be required to do once suspect will be having peptic ulcer disease? One, you might be required to do what we call antigen test, H. pylori antigen test. And in this case, you'll take a sample from your stool to determine whether you have the H. pylori antigen. So that will call H. pylori antigen test. The other one is H. pylori antigen antibody test. And in antibody test, we normally take a sample from your blood. But one thing you have to know is that the antibody test, whereby we are using the stool for checking, is more accurate than the antibody test, whereby you are using blood sample. Other investigations you might also be required to do the polymogram, the liver function test. You can also do you can take stool for hot blood. You can also do take gastric content for culture and sensitivity. That's in cases whereby H. pylori has become resistant. And in addition to that, you might be required to do what we call image studies. And in image studies, the most preferred one for patients suspected to be having peptic ulcer disease is what we call esophagogastroduodenoscopy, or OGD in short. We normally call it OGD in short. So you may be required to do this imaging study in combination with what we call biopsy for histology, so that you can rule out a malignancy. So those are some of the investigations that you will be required to do when suspected to be having peptic ulcer disease. And at this point, it's my hope that you have learned something and you are still improving. Since yesterday, in the way we started our topic up to now, it's my hope that you are still learning. So let us meet in my next video, whereby we will be discussing on treatment of peptic ulcer disease. So kindly don't miss. Have a blessed day and thank you for watching.